you also had a medial meniscus repair, meaning I sewed it back together, as opposed to a meniscectomy, meaning removing part of the meniscus that was torn, and you will also be instructed to use crutches to only put partial weight bearing on. We will limit your motion for the first 4 weeks from 0 to 90 degrees. When you're walking around or sleeping, we'll have the brace on so that you don't bend the knee past 90 degrees. All right, welcome home. You just had your knee arthroscopy, and this may have included a meniscectomy, a chondroplasty, or a host of other things other than an ACL reconstruction or a meniscus repair. When you get home, your weight bearing is tolerated with a cane in the opposite hand. There's no brace, so you can walk with the cane in the opposite hand of the operative leg as tolerated. But the goal is to control swelling. That is why I've asked you to stay home for the first week after surgery, so that you can control swelling on your own, so that you can recover quicker. When you get home, you will notice you have an ACE bandage, a cold blue pad, and an ACE bandage on your leg. Leave that on at least for 2 to 3 days. After 2 to 3 days, you're going to take this off to shower. You're going to take off the first ACE bandage, and save it. Take off the cold pad. It's got Velcro on it as well. And you're going to save that. And the third ACE bandage you're going to save as well. You'll notice that underneath there is a lot of white cotton padding. You're not going to feel the cold pad very much that first day or two because of the padding. That's okay. Cold is getting in there. You're going to rip off the cotton padding. It's very easy to rip. And you're going to see loose gauze pads. You're going to take those off and the little yellow things that are attached to it, and you're going to throw those away. You're going to see white strips on your skin. Leave those. Those are your stitches. I do plastic surgery closures to minimize any wounds. Don't take those off or you may open it up and it could get infected. If for some reason the white strips come off before the wounds are healed, you'll need to do wound care to prevent infections. Simply peroxide, Neosporin, or bacitracin and a Band-Aid is fine. If you have any questions, call me. When I see you in the office, I will take these off. If they come off after 1 week and the wounds look healed, you don't really need to do anything, but if you'd like to put Band-Aids over it, that is fine. You're going to do some exercises 4 times a day. You're going to do some straight leg raises, so you're going to actively be lifting the leg about 12 inches to 6 inches. Quad contractures just means tightening the muscles, and bending the knee just means bending the knee back and forth. The goal is to get the quadriceps to work before going to therapy. It'll quicken your recovery dramatically.